it's important to put a bit of context. So this survey was distributed last year between January and September. And last year we had tons of data coming up on that space. So we had the data from the overall survival of the MARIPOSA study. So first line Amivantamab plus Lazertinib versus Osimertinib. And later on that year, so after the survey was had already ended, we had the overall survival data from the FLORA-2 trial, so combining chemotherapy plus Osimertinib, and both versus Osimertinib. So both trials showed a similar benefit in terms of overall survival. But what we see in the survey that we have is that overall, physicians think that they will give first-line single-agent Osimertinib to around 60% of their patients, then chemo-Osi to around 30% of their patients, and Amilase to around 10% of their patients. For me, this was surprising indeed, given the data that we have nowadays. But I think that now that if we would repeat the survey now, probably the chemo-Osi or the Amilase combinations would be much more used. But what we saw, and that was what we're expecting, is that physicians would prefer to give Osi monotherapy to more senior patients, more frail patients, patients with comorbidities, patients that value quality of life over duration of survival. And that's what we know from most clinicians do. They have this discussion with their patients in their clinics. There are patients that, of course, will not even discuss chemotherapy because they have comorbidities or other impediments. Then Amivantamab, Lazertinib, we might, but there is also an important education that has to be done, and the patient has to be really following all these prophylactic measures to decrease rash. So I think it was a nice survey to understand how the treatment landscape is evolving in the real world. So like how physicians are putting all of this knowledge into their clinical practice.